Urgent oral question to the Minister of Health. I would remind members that if they wish to ask a supplementary question, they should rise continually in their places. The member who tabled the question will be called automatically to ask a supplementary. Clerk, please read the question.
To ask the Minister of Health to respond to concerns raised by service users and health and social care advocates in relation to his department's new policy on continuing health care in Northern Ireland.
And I call the Minister of Health, Robin Swan.
Very much, Mr. Speaker, and this is a welcome opportunity to clarify the situation regarding continuing health care. I appreciate that social care is an extensive and complex area. However, I would urge members and all those listening not to conflate the issue with the policy decision that has been announced in another area of the United Kingdom last week. The fact is that continuing health care has become an outdated and much criticised scheme, serving principally to offer only confusion and false hope to individuals and families. A review carried out by my department following an AGNI report in 2014 found a risk of variance in the application of departmental guidance and in continuing healthcare practice across the trusts. This led to regional inconsistency and a potential postcode lottery for individuals. The department undertook a consultation launched in 2017 which was designed to establish a clear position on the matter. I inherited the scheme and the public consultation on its future. I wanted to provide more clarity, at least in the short term, pending wider consideration on how social care should be funded in the future. In taking up my role, it was clear that previous inequality, confusion and variance across the region needed to be addressed. In February 21, I gave approval on the way forward with the aim of creating a fair system. A stakeholder working group has already been established with the aim of producing guidance to underpin the new position. The aim has always been to publish the guidance over the coming weeks once the working group has been able to come to an agreement. I can very much appreciate the concerns raised by service users and advocates, and it is only right that when issues are raised that they are addressed by those in government responsible for decision making. The matter of continuing health care is only one small part of the health and social care system, but it very much relates to the wider issues relating to social care, how it is provided and how it is funded. I am therefore very keen to look at this matter in the round in the wider context of how we deliver health and social care in Northern Ireland. The reality is that many people, particularly older people, need to move into care homes because of the impact of medical conditions on their ability to look after themselves. An argument could perhaps be made that the state should provide free or subsidised social care in such circumstances, just as it provides free health care at the point of need. It is also the case that the financial cost of such provision would be significant, with major implications on other areas of public spending, and I look forward to this House addressing such issues in the forthcoming public consultation in relation to the reform of adult social care.
And I call Pam Cameron for supplementary.
Thank you, Mr. Speaker, and I thank the Minister for making himself available to the House to answer questions on this incredibly important topic, because many across NI will be rightly concerned at how their care needs are going to be met now and in the future. The Marie Curie response to the consultation on continuing healthcare in Northern Ireland, specifically on option 3, which is the Department's preferred option, which has now been introduced to introduce a single eligibility criteria question, was, and I quote, "Marie Curie does not support the implementation of the single eligibility criteria model in Northern Ireland. We believe that, as currently presented, this option amounts to the abolishment of continuing healthcare funding for local patients." My colleague Arlene Foster had submitted a question last week asking, given Her Majesty's Government's announcements on social care, has the Department any plans to replicate the proposed cap on the cost of social care for residents in Northern Ireland? Perhaps the Minister can give some clarity today. Through the Speaker, I ask, is there not a moral obligation on the Department to look at the cases of many people in nursing homes across Northern Ireland who were not even made aware of their eligibility for continuing healthcare before the policy was scrapped?
I thank the member for her point, and as I said in an earlier consultation, an earlier answer in the first part, the review was carried out following a report by AGNI. This policy has also been brought to light in the need for the publication of the guidance was actually raised by NIPSO when they consulted in 2017 in regards to the variance across trusts. And that's why I think in regards to continuing healthcare, where in fact we only see 1 out of the 5 trusts actually utilising the current policy in regards to continuing healthcare. And as I said in my initial response as well, I think it's vital that we do separate continuing healthcare in regards to the review of social care and the reform of adult social care, which has been, I think, as the member indicated, a query that had been raised by our party colleague Arlene Foster. And I do look forward to the House addressing such issues and also the input of parties and individuals and organisations like Marie Curie into the forthcoming public consultation in relation to the reform of adult social care. But it would also be worth noting those individuals and other political parties who actually made the time to put input into the public consultation on the reform of continuing healthcare when it was actually launched in 2017.
Call Orlia Flynn.
Miagat Akankolia. Minister, in your opening remarks you had mentioned the stakeholder working group that's been set up around some of this work, and I know that it was back on the 22nd of March you had gave that commitment to establishing that working group. So my question today would be, can you confirm how many service users, carers or advocacy groups are on that working group, and has it met yet? Thank you.
And I thank the member for the point. The working group has met. It's due to meet again in another couple of weeks, and at that stage we had hoped to have the publication of the guidance. It doesn't look that it'll be able to finalise that at the second meeting, but hopefully at the third meeting. We actually asked AGNI to sit on that group because, as the member will be aware, they do recognise and represent a large cohort of the service users and potential applicants to this scheme, but also they were actually very critical of the department's response. So we brought them in as, I suppose, a critical voice as to how we actually prepared the guidance as to what should be, I suppose, the future of continuing healthcare before it becomes part of that wider review of adult social care in Northern Ireland.
Call Cara Hunter.
Mr. Speaker, and I'd like to thank the Minister for his answers so far. Minister, you'll understand this is a very emotional issue for many of my constituents. I know several people who have had to sell their homes and use their savings to afford access to care. Can I ask the Minister, have you spoken with individuals impacted by this issue, and what is your assessment about how this approach is impacting them using their savings and selling their home to afford access to care?
And I thank the member, and as I said, I think in my initial response, I think we need to not conflate continuing health care with the reform of greater social care as well, because they're two very separate issues in regards to the continuing health care scheme that has initially been discussed and was part of the urgent oral has actually only been utilised by 1 trust across Northern Ireland, where I think the member actually refers to the greater reform of adult social care in Northern Ireland. As I have also said, that there will be a public consultation in relation to that aspect of our healthcare service here in Northern Ireland, and I do look forward to the House addressing such issues in the forthcoming public consultation as well. But I will note that the Members' Party was actually one of those parties who actually did put in a submission to the public consultation on the continuing healthcare public consultation when it was launched and was active.
Call Alan Chambers.
Mr. Speaker, I look forward to the Minister's upcoming consultation on adult social care reform. It will likely come with significant funding commitments, however. So does the Minister envisage any challenges around the executive table when he makes the case that funding consequentials from health spending in England should also be earmarked for health spending in Northern Ireland? Thank you.
And again, I thank the member, and that's, I suppose I'm conscious not to mix what has been announced in England in regards to what they're doing in social care and the funding, but there is a Barnett consequential to that announcement, which I've asked around the executive table should be earmarked and should be ring-fenced for health and health spend in Northern Ireland, because unlike England, Northern Ireland, actually our social care service is actually part of our healthcare service, whereas in England it's actually looked after by local councils and districts, whereas it's all done by ourselves here in Northern Ireland. So I do ask, and for anyone who's raising concerns in regards to either funding of this policy, of the greater reform of social care, domiciliary care, that they do support my ask at the executive table, if they come from an executive party, that Barnett Consequential is earmarked and ring-fenced for health provision in Northern Ireland.
Call Paula Bradshaw.
And thank you, Minister, for coming to the Chamber today to provide some clarity on this. My question's in relation to the assessments and those who conduct the eligibility assessment. And you said that there's only one trust. Do you know why the other trusts are not doing that? And what sort of background do these assessors have? And also then, what is built in terms of review of an assessment? Because we know that people's situation can deteriorate quite quickly. Thank you.
I thank the member, and I think the reason there is only one trust utilising continuing healthcare is because of that inconsistency and non-consistency, I think, across the trust as to the understanding of what the service was actually about and how it could be funded and how it could be accessed. And that was why, in the NIPSO's report, actually reports failings in the health service should be documented and addressed, and I welcome that. We were and are aware of the issues previously raised by NIPSO in respect of the previous policy. Those were well documented and indeed actually further underscored the need for that 2017 consultation. So that is, I think, part of the reason why only one trust has been utilising this system in regards to the past. But in regards to the assessments and how they are conducted and how they will be utilised, that will be part of the work of the stakeholder forum going forward to make sure that any guidance that is issued and applicable and practised on a regional basis rather than solely in one trust area.
Rachel Woods.
And thank the Minister for attending the Chamber today. And you'll be aware I've written many times to your department on constituency issues in relation to this. Can I ask how long it is between an application for continuing healthcare and a decision? Because, for example, if a person applied for continuing healthcare assessment, say back 10 years ago, wasn't assessed, sadly died, what appeal mechanism is there for payment of fees charged by the trust that have now been passed to their family members?
I'm aware the member has issued a number of very specific constituency issues on that in regards to the questions she asked. If she's content, I'll come back to her in writing on that specifics, because I don't want to give an inaccurate answer to her in regards, but there's obviously a live case with her at a constituency level.
Call Jim Allister.
Is the Minister in a position to tell the House how many people across Northern Ireland are actually in receipt of continuing healthcare provision in terms of funding? And secondly, will he come off the fence as to whether or not it is his ambition that in Northern Ireland there should be a cap on the amount that ultimately a family has to pay?
I think in an answer to the first part, 72. An answer to the second point, I think it would be premature for me to answer that question before the public consultation and the options are actually launched in regards to what we intend to ask the people of Northern Ireland in a public consultation, because the members are often critical, and rightly so, that many consultations are published with a predetermined decision already in place. So I think the member is actually asking me to take a position that the consultation actually hasn't been launched nor decided on yet, so I'll not be tempted to do that.
Jerry Carroll.
The Minister outlined what consideration he or the working group he referred to have given the conditions faced by domiciliary care workers who often have to pay their own mileage or travel time between people they care for, and there's no care system without care workers. And can the Minister also confirm that there was less than 50 responses to the consultation in 2017? Thank you.
I thank the member there was 43 consultation responses to the consultation in 2017. I think 19 of those were actually from individuals who obviously had experience of the system. But again, not to conflate our domiciliary care service and what we're actually doing across the community in Northern Ireland with this specific point of continuing healthcare. Members will be aware of the continual challenges that we are facing currently in our domiciliary care sector, both in the independent and statutory sector. That's why, again, I've asked for the establishment of a social care fair work forum will actually look to support and develop Northern Ireland's social care workforce. The member's well aware of the value and the importance that I've put in that workforce. It's a workforce that is currently depleted and under pressure and struggling to manage what is an ever-increasing workload at this point in time. So I've asked that new body to be tasked with developing proposals to improve terms and conditions and also career prospects for social care staff. And I am hopeful, that this will assist the sector to actually to recruit, develop and retain committed, skilled and well-motivated workers and provide a voice for the workforce who often feel marginalised within our healthcare system as well, because there is no avenue or representative forum for those care workers, which I actually hope that our Social Care Fair Work Forum will actually provide for them.
I call George Robinson.
Thank you, Mr. Speaker, and can I thank the Minister for his answers so far. Mr. Speaker, could I ask the Minister what guidance has been developed in relation to the implementation of the new continuing healthcare policy, and how were service users and families consulted as part of this process?
I thank the member for his question. He will be aware that, as I said, I've established a working group to do that. It will involve representatives from the trusts, my own department, but also AGNI, to prepare that guidance so that it is fit for purpose. And by involving AGNI as well, we'll make sure that service users' voice is actually heard. So when we do publish that guidance, there's representation from around the table and around providers and users as well, as to make sure it's understood and easily understood as to those who either can apply for it or is going to be applicable to.
I call Sinead Bradley.
Mr. Speaker, and I thank the Minister for being here today on this issue. Minister, could you advise me if the Department are working proactively in any way to engage with those families who may have loved ones who were denied access to an assessment? And I ask that not only because it's the right thing to do, to engage with them, but also there may be potential court cases if these things are not settled in an amicable way.
Anyone who had applied for a continuing healthcare grant or application prior to February will still be assessed under the old scheme and will still be applicable to those payments. They will be eligible should they be deemed necessary. If the member has specific constituency issues that she wants to raise or write to me with, I'll carefully consider those and pass them on to the relevant officials within the department for consideration.
I call Jonathan Buckley.
Thank you, Mr. Speaker. And I think this Note and Show investigation goes to the very heart of how we as a society treat and indeed provide care for our fellow citizens. I was alarmed when I listened to the accounts of many individuals whom were not even offered the continuing care option, and I do believe there's a moral obligation on the Department to follow up on these to ensure that there is retrospective provision. How would the Minister respond to the allegation that this policy was more about closing a loophole and cutting costs than a fair or evidence-based approach to long-term care? And can I ask why this was not brought to the Executive when it was a significant and controversial and cross-cutting issue?
I thank the member. In the last point, it wasn't and isn't. But what I will say to the member as well, being a member of the Health Committee, he will be aware that I wrote to the committee on the 8th of October 2020 in regards to this issue. I also supplied the Health Committee with a copy of the report in full on the 11th of February. The member will be aware, as I said, it was also out to public consultation through a period of 14 weeks in 2017, and there were only a small number of political parties that actually responded to that consultation at that point in time. So in regards to the access and the availability of the scheme, trust individuals would have been informing families and dealing with families. That now has been, and again, I will say to the member, this is a very small part of the greater reform that we actually need in regards to our reform of adult social care here in Northern Ireland. We're already seeing that piece of work being started in Westminster, and I hope to bring forward the consultation in regards to that relation to reform of public social care that I hope the member partakes in and his party actually supports and develops as well in regards to how we fund it and what actually people in Northern Ireland have to pay for their social care.
Members, that concludes this item of business, and will members please take your ease for a moment or two? Thank you.